Hi, I'm Alexis. I'm going to be your nurse for today. I'm here to do head and toe assessment. Is that okay with you?
Yes.
Okay, I'm going to wash my hands. Okay. Can I see your wristband? Can you tell me your first and last name?
Marcel and Dubose.
Okay, can you tell me your date of birth?
October 15th,
What year?
2014.
Okay. Can you tell me where you are right now?
In Michigan.
No, where are we right now?
In my room.
Okay. Do you know why we're here? Okay, good. So, oriented times 4. I'm going to take your heart rate, blood pressure, temperature. Please stop that. Pulse ox, respiratory rate. And are you in any pain?
No.
Okay. Don't do all this. Okay, I have all my vitals. Now, first I'm going to inspect the skin color of your head. Okay, it's normal color. It's not it's nice and brown. Your head is proportioned to your body. Look at me, let me see. I don't see any drooping on your face. Your eyes and ears are the same level. So I'm going to test cranial nerve 7. I need you to close and open your eyes. Okay, I need you to smile. Now frown. Puff out your cheeks. Okay, very good, very good. Cranial nerve 7 is intact. Now I'm going to palpitate your head. I'm going to put on some gloves. And I'm going to palpitate and feel through your hair. I don't feel any masses, any baldness, any breakdowns. Okay, it's all good. Okay, so I'm going to wash my hands. Take the gloves off and wash my hands. Okay. Now I'm going to check the temporal arteries. So the temporal arteries, I have to find them right here. Near the sides of the head at the temple. Okay. And I can test cranial nerve 5, which is the trigenital nerve. So I need you to bite down with your teeth. Okay. And I want you to open and close your mouth. Open and close your mouth. I don't hear any clicking. Very good. Now I need to, so that was the temporal mandibular joints. And there wasn't any clicking. That was good. I need to pulsate the sinus. Tell me if you feel any pressure. I'm going to pulsate the maxillary and frontal. And you tell me if you feel any pain or pressure. Maxillary, which is under the eye. And frontal, which is above the eye. Any pain or pressure? Okay, good. I need to inspect the eyes now. Mind if I look at you? Okay. No swelling. Let's put on your eyelids. Nice and pink. No drainage. Eyes are straight. Pupils are the same size. Okay. Now I need to assess cranial nerve number 3, which is the oculomotor. So I'm going to use the pen light. This here is my pen light. I need you to follow the pen light. Don't move your head. Follow the pen light with your eyes, okay? Don't move your head. Try to keep your head still for me. Try to keep your head still. Okay, very good. Okay. I'm moving in and out, left, right, down. Pupils are equal, round, and they are reactive to light. Now I need to inspect the ear. I'm going to be looking for redness, drainage, and irritation or pain. Let me know if you feel any pain or discomfort while I palpate the ears. Okay, it's normal, no pain. Okay, no tenderness. Now I need to take my pen light to look inside the ear. Tilt your head to the side. I'm going to look inside to your inside of your ear. Okay. So I'm checking cranial nerve 8, which is the vestibulocular nerve. And I want to look inside the other ear, okay? Okay. Now, I'm going to cover one ear and I'm going to whisper on this side. I need you to tell me what you hear, okay? If you hear anything at all, okay? Okay.
Pizza, chicken.
Okay, very good. And I'm going to do the same on the other side. I'm going to cover this ear, and then if you hear me say anything, I need you to tell me what I whisper, okay? Candy, pop.
Candy, pop.
Okay, very good. So, cranial nerve 8 is intact. Now I need to check your nose. Let's see. Okay, your nose is in the center of your face. I don't see any drainage. Do you feel any pain in your nose?
No.
Okay. Can you cover one side of your nose and breathe in and out? Very good. Can you switch and do the same thing on the other side? Very good. Good airflow. Okay. The nose is nice and patent. I'm gonna look inside, tilt up. Nose looks clear. Now I need to check cranial nerve number 1, olfactory. Can you close your eyes? Wait, I'm gonna get something really quick. Close your eyes. Do you smell something? Logan, I'm doing a video. Get back. Do you smell something? Can you tell me what you smell?
Mom, touching it.
Get out. I'm gonna show you what I'm doing. Can you tell me what you smell? Was it what kind of smell was it?
a perfume something.
Okay, very good. So, cranial nerve 1 is intact because you're able to smell. Okay. I need to inspect your lips and your mouth. Lips are nice and pink. They're moist. I don't see any sores. Can you open your mouth for me? I need to check cranial nerve, hypoglossal nerve. Okay, I'm gonna take my tongue blade. Can you stick your tongue out? Can you move it from side to side? Okay, tongue is nice and moist. I don't see any discoloration. Okay. It's moist. Can you lift the tongue? Okay, I don't see any lesions. Can you open your mouth? Ah. Okay, I don't see any cavities or any broke or loosened teeth. Okay, now I need to check cranial nerve 9, glossopharyngeal. I have to make sure that the uvula is centered. So can you say ah for me? No, I need to hear you say ah.
Ah.
Okay, and your uvula did move. I need to check your gag reflex. Okay, very good. Now I need to check cranial nerve 10, vagus nerve. It's intact because, no, I know that cranial nerve 10, vagus is intact because you're able to swallow without a problem and you're able to talk without being hoarse. Can you turn it back this way for me? Okay, now I'm going to wash my hands. Okay, now I'm going to examine your neck. I need you to extend your neck upward. Okay, your trachea is midline. Okay, now I need to test cranial nerve 11, the accessory nerve. I need you to move your head side to side for me. Okay, and I need you to also look up and down for me. Okay, just slow a little bit. That's good. Now I need you to shrug your shoulders against resistance. So push up. I'm gonna put my hands out and I need you to push up. Okay, very good. Now I need you to I need to make sure your jugular veins are not distended, which they are not. Feel the center of the neck for lumps and tenderness. So I'm palpating the trachea, okay, which is right here in the center of your neck. Do you feel any tenderness, any pain? Okay, I don't feel any lumps or any jugular vein distensions. Now I need to palpate the lymph nodes for hardness or lumps. The preangular, which is right here in front of the ears, and then post-arcular, which is in back of the ears, and then occipital, this is here, parietal, which is here, jugular district under the ear. Submandibular, which is submental, which is under the chin. superficial cervical, which is, work my way down to the cervical chain. Please be still. Toward the end of the neck, the posterior cervical here. The super parvicular. Okay, no lumps, no tenderness. Now I need to palpitate the carotid artery one at a time. Okay. Okay, they're nice and boundy. I need you to breathe in and out. And I'm going to listen with the back of my bell for squishing sounds or okay, I didn't hear any squishing sounds or anything abnormal. Now I need to inspect your extremities, your arms and legs. Can I see your arms and legs? Okay, very good. I don't see any IVs or wounds. I need to check your capillary refills. Can I see your hands? How's your hand rotation? How's your hand motion? Any pain? Any pain anywhere?
No.
Okay, so I'm going to check your capillary refills. I'm going to hold this for a little bit. Okay, and the color comes back right away. Good capillary refill. I need to check this one. Can I check this hand? Okay. Good capillary refills. Okay. Now, I need you to squeeze my fingers as hard as you can. I skipped the piece. I need to pinch your skin and do a skin tugger. Okay, that's very good. That's a good skin tugger. I need to look at the joints and the rotation of your hand, which I just did. Are you feeling any pain or anything in your hands or arms at all?
No.
Okay, very good. I need to palpitate the brachial artery, and that's in the bends of the arms. So right where you have them folded at, I need to go in up under here and just basically palpitate in the circular motion. Okay. Now can you squeeze my fingers as hard as you can? With one hand. Okay, very good, very good. Normal muscle strength. Can you squeeze with this other hand as hard as you can? Very good, very good. Now I need you to push your arms against my arms. So let's push our arms against each other's arms so I can test your strength. Push. Okay, and now I'm going to push back. Now let me push. Okay, very good. Okay. Normal strength. I need to put my hand under your elbow and feel as your arms go up and down. Okay? Have your arm up and down. Okay, very good. I need to do the same thing on the other side. Any pain, any discomfort? Okay, very good. Hold your arms out. Okay, can you stand up for me? Close your eyes. Hold your arms out. Okay, the arms are not drifting or anything. Okay. Okay, very good. You can open your eyes and put your arms down. You may sit back down. Now, can you take your shirt off for me? I'm going to inspect your chest. Thank you. Okay. I don't see any wounds or abrasions. Okay. Can you sit up kind of tall for me? No, you don't have to stand at all. Not yet. Well, maybe yeah, stand for the video. So I don't know if they can see you. Okay. I don't see any struggles in your breathing. So I'm gonna calculate your heart sounds in 5 locations. I'm going to be checking the aortic, the pulmonic, the Erb's point, tricuspid, and the mitral acupul pulse. Okay. And I'm going to be listening for the love dove sound. Okay. Just be quiet. Okay, very good. Okay, now I'm going to turn the bell over and I'm going to listen for any murmurs or anything abnormal of the heart. In the same 5 locations, we're going to go with the aortic, right across to the pulmonic, Erb's point, tricuspid, mitral acupul pulse.
Mama.
I don't hear any heart murmur signs, sounds, or any abnormal beating or anything.
Mama.
Now I'm going to listen to the back. I'm going to the left and right lungs.
Mama.
Okay.
Mama. Mama.
Can you take a deep breath for me? Breathe in and out. I'm checking for the apex. Well, actually, I'm up here checking for the apex. Deep breath. Now I'm going to move to the second intercostal space. I'm here at the right upper lobe. And I'm going to go across to the left upper lobe. Please be still. Okay, can you take deep breaths in and out for me? Not. Okay, very good. Now I'm going to go down to the 4th intercostal space. The right inner lobe. Then I'm going to the left upper lobe.
Mama. Stop it.
Okay, now the apex, I'm going to check them one at a time. Continue to take deep breaths for me. Okay, very good. Now I'm going to compare it to the other side. And then I'm going to go to T3, which is the left and right upper lobes. Please be still. And continue to breathe normal, please. I'm with the patient.
Okay.
Across to the other side, I'm going to do the same thing. Now I got to go to the right and left lower lobes. Okay, sounds good. Now I'm going to, I need to inspect your stomach. So I need you to lay down flat for me on the bed if you can. Okay. I'm going to, I need you to lay flat. And I don't know if my camera can see you. It's gonna be hard. Is that it? Okay, keep on the leg a little. Thank you. Okay. I need to inspect the abdominal. When was your last bowel movement? When was the last bowel movement? Did you have one yesterday or today?
Yesterday.
Okay. Do you have any pain during urination when you go use the bathroom?
No.
Okay. Do you have any abdominal discomfort?
No.
Okay, very good. I see the erotic pulse. I don't see any hernia. Now I'm going to listen to your bowel sounds. Okay. You comfortable?
Yes.
Okay, I'm going to listen to your bowel sounds. I'm going to listen to all 5 quadrants. There should be 5 to 30 bowel sounds per minute. And I need to listen for 5 full minutes. So I'm going to start with the right upper quad. Then go across to the left upper quad. Then down to the left lower quad. Then across to the right lower quad. The aorta artery, I don't hear any brewing. Okay. I'm going to check the right and left renal artery. Okay. It's the right side first. And then I'm going to go across to the left renal artery. Okay. Now I'm going to check the iliac artery, which is below the navel here. And then the other side. Okay, now I'm going to palpitate. Let me know if you feel any pain or tenderness.
No.
Wait, you gotta let me do it. I gotta palpitate the right lower quad, the right upper quad, the left upper quad, the left lower quad. Any pain?
No.
Okay, now I'm gonna do deep palpitation of the same things. The right lower quad, the right upper quad, the left upper quad. So I'm going right across. Okay. Let me know if you feel any pain, any tenderness, any discomfort. And I'm going to go down to finally do the left lower quad. How was that? Okay. How you feeling?
Good.
Okay, very good. Now, I'm going to inspect your lower extremities. I need to inspect the color. You mind removing your socks for me, sir? Can you take your socks off for me? And you can scoot up. Actually, you don't have to lay down anymore. You can sit, back up in your chair. Ooh, this hurt. Okay. Okay, so if you had a gown on, I don't see any color discoloration, the skin discoloration, any redness or swelling. I don't see any redness or swelling. Do you have any pain? Okay, your toenails look clear and clean and cut. Okay, nice and neat, healthy. Okay, I need to palpitate the palpebral, and that's behind the knee. I need to check them both. Okay, they are equal and bilateral. No edema over your lower extremity. I need to feel the posterior tibia, which is the back of the foot. Let me see. It's like at the back. Let me see. It's like at the Achilles, like above. Let me. Okay. Okay. I need to feel the dorsal pedis, which is on top of the foot. Can I feel those? Okay, very good. Now I need to check the capillary refills on your foot, just like we did with your hand earlier. I'm going to hold it for about 10 seconds. Apply pressure. Okay, good capillary refills. Can I check the other one? So I'm holding it, apply pressure. Okay, color comes right back. Good capillary refill. Now, I need you to push against my hands. So you can scoot back in the bed. I'm gonna push your feet, and I need you to push them against me pushing. Okay? Ready? Push. Okay, very good. Now I need you to lift. I need you to lift your feet. I need you to lift your legs while I push them down. I need you to lift them like up in the air against the resistance. Okay, not much. Come on, push them up against resistance. Very good. Down. Okay. I can assess the back for breakdowns and swelling. Can you sit up for me, sir? I need to assess your back for any anything that would be considered abnormal, any swelling, any lumps, any discolorations, any breakdowns. Okay. Appears normal, no abnormal findings. Okay. So we're all finished here with the head to toe assessment. This concludes the assessment. Thank you so much.